Hi, this is Dr. Michael Persky from Encino, California, or as we like to call it, the Beverly Hills of the San Fernando Valley. I'm a facial plastic surgeon at Persky Sunder Facial Plastic Surgery, and tonight I'd like to speak to you for a few minutes about one of the holy grails of plastic surgery, which is non-invasive body tightening of loose skin. In our practice, we see patients who are often complaining of loose skin on various parts of their body, including the abdomen, the arms, the legs, the thighs, the butt. Pretty much wherever we have skin, there are some patients who want it to be tightened, and they want it to be tightened without surgery, non-invasively. The original skin tightening non-invasive device was Thermage. Came out about 15 to 20 years ago. The problem being that there was a high patient dissatisfaction with the procedure. Reports of 30 to 40% patient satisfaction. Currently on realself.com you can look up whether procedures are worth it or not, and Thermage has an 38% patient satisfaction rate. Other radiofrequency devices such as Titan at 53%, Accent XL at 56%, Excelis at 70%, also have not great patient satisfaction rates. The current leader of patient satisfaction with non-invasive skin tightening devices that use radiofrequency is the Venus Freeze, which has an 87% patient satisfaction rate. Patients want to know how radiofrequency works. It works by heating the skin similar to the way a microwave heats material. The waves are carried through the skin down through the tissue, creating just enough heat to cause some damage. The body's healing response forms collagen, which results in tightening of the skin. It usually requires multiple treatments, usually a treatment once a week for 4 to 6 weeks, followed by maintenance therapies, which can be once every 1 to 3 months. The benefits are that it's a non-invasive modality of tightening the skin. No surgery is required. There's minimal discomfort. Feels like a warm massage. There's minimal risk to skin changes. All skin types could be treated, and there's no downtime with the procedure. The risks are some of these devices have reported rare burns. The skin can be red for a few hours after the treatment, and rarely there can be loss of volume, which is why in our practice we don't really use radiofrequency devices on the face. We're quite happy with using ultrasound devices, actually ultrasound device, Ulthera, to lift and tighten the face, neck, and brows. Radiofrequency devices such as Venus Freeze, Excelis are good for non-invasively lifting, tightening the neck and jawline for patients who aren't quite ready for the more intensive, effective Ulthera treatment. The frequently asked questions about radiofrequency skin tightening. Is it painful? It should feel like a warm massage. There are some of the devices that are quite painful. Fortunately, the Venus Freeze that we've been trialing in our office currently is just feels like a warm massage, and most of our patients, again all of our patients who have tried it so far, are quite pleased with their results. Is there scarring? Very, very rarely, and it hasn't been reported with the Venus Freeze device. What are the short-term side effects? There could be temporary swelling, redness, and temporary numbness. All of these things go away within hours. Do patients need anesthesia for the treatment? And the answer to that is no, not with the Venus Freeze. So I hope that answers most of your questions about what the current best non-invasive radiofrequency skin tightening modality is. Currently, I believe it's Venus Freeze. We'll see. it's certainly been the holy grail of plastic surgery. To wrap this up, as with all of our treatments, I think it's very important that patients have realistic expectations, and it's our job as physicians to convey those to the patient. As you've heard from the patient satisfaction rate, even with the best of these technologies, there's a 15 to 20% patient dissatisfaction rate, or patients are not seeing much results, or they don't think it's worth their money. The last thing that I want in our practice is to have unhappy patients. Again, it's important for our patients to have realistic expectations. This is currently the best technology that's non-invasive to tighten the skin, but it doesn't work for everybody. We're not smart enough to know why that is, who it's going to work on, and who it's not. But there will be patients that will see great results, and there will be, unfortunately, a small percentage of patients who don't see the results they want. So that's to be taken into consideration prior to undergoing the cost of both money and time in pursuing these radiofrequency technologies. If you have any questions about any non-invasive skin technology, please feel free to call me, and be well. Take care of yourself. Bye-bye.